Mhm. Yes.
Sir, live is started.
Yes, sir, we are live.
Okay. Can we start, sir? A very good
Yes,
evening to all the eminent doctors. Thank you so much for joining us for today's webinar. Our endeavors is to spread awareness about rabies, which is a fatal but can be avoided once appropriately vaccinated. This is an initiative from Cadila Pharmaceuticals through its innovation to save the society and humankind. The topic of this webinar is doses reduction strategy in rabies management, role of novel vaccine. Dear doctors, the rabies is the world's first novel 3-dose anti-rabies vaccine, and with great pride, we would like to inform you that rabies has successfully completed 1 year of launch with more than 40,000 animal bite victims being vaccinated. 100% compliance was recorded and no case of ADR was registered. With this, it is my honor to introduce you to the speaker of today's webinar is Dr. Lokesh Birukala, sir. Doctor was practicing at Karimnagar. Sir was MD physician, general physician, and very famous doctor in Karimnagar district. Now I would like to request Dr. Lokesh sir to initiate the talk, and later on we will have the question and answer session also. All the participants can drop their question in their drop box, and we will read out all the questions after the presentation. Lokesh sir, you can start the presentation.
Yeah, sure. Good evening. Thanks a lot for your kind introduction, Srinivas Garu. So I think it's my pleasure to be a speaker for the meeting for Cadila Pharmaceuticals. So this evening we'll be discussing about the novel 3-dose G protein vaccine, which is an ultimate key for compliance. So as everyone are aware of rabies, so it's very much life-threatening. So we have to act very early to prevent morbidity and mortality. So it's a public health challenge in India still today. So according to APCRI, that is the Association for Prevention and Control of Rabies in India. So globally, there are like around 59,000 human deaths annually. The highest have been recorded in India. So India had almost 20,000 human deaths a year from rabies, which accounts for almost 60% of rabies deaths in Asia and 35% and around 35% globally. So of this, almost around 91% deaths in India occurred in rural areas. So this is area has to be also in focus. So every 9 minutes, a person dies from rabies. So this tells us how impactful the disease is and how much trouble the pain the family could bear if the person had rabies. So what is the current management? So of course, the first the local wound treatment, that is first aids, and then comes the active immunization with vaccines. And of course, if the bite is serious, then with passive, along with the active immunization, we also go with passive immunization by giving the RIG, the rabies immunoglobulin vaccine. So you can see the rabies post-exposure prophylaxis. So a normal thing is we recommend the person who have been a victim for the dog's bite. So we have to wash the wound immediately for 15 minutes over running water with soap, water, and disinfectant. So depending upon the type and grade of injury, so either active along with passive immunization is given. So normal thing is 5-dose regimen is followed. So one intramuscular dose of vaccine on days 0, 3, 7, 14, and 28 days is given. So normally thing is this vaccine has to be administered intramuscular in deltoid upper arm or anterolateral aspects of thigh only, never in the gluteal region. So this has to be kept in mind. So depending upon the category of injury or the wound, we follow this management. So what are the current challenges of this post-exposure prophylaxis with rabies vaccine? So one thing is the non-compliance. So one more thing is the current rabies vaccine, the cell culture vaccines. So the inactivated vaccines are more than 50 years old technology they use, so they are inconsistent in their potency, stability, availability. Also, there's a short supply, and also a risk of adverse events is little higher. So coming to the compliance of anti-rabies vaccines. So there are three groups basically. Compliant, one who receive the full course of ARV, that is the scheduled doses of ARV on the recommended dates. So one is delayed compliant. So who have completed the scheduled dose of ARV within 60 days, but they have deviated from the scheduled regimen, that is 03714. So the last one is the worst one, the dropout or non-compliant one, who had taken at least one dose of ARV after animal bite, but not completed all the scheduled doses. So they are of high risk of developing the complications of rabies, or they can succumb to rabies and ultimately die. So you can see what are the limitations to 4-dose WHO recommendations. So rabies post-exposure prophylaxis in routine practice in view of the new Centers for Disease Control and Prevention and World Health Organization recommendations. So this was a retrospective analysis done at travel clinic. Say around total of 110 patients who received rabies 4 doses as post-exposure prophylaxis were taken. So the shortcomings in the management of these patients were there was late initiation of rabies, PEP in travelers, and the administration of human rabies immunoglobulin. And still the antibodies levels were less than 0.5 international units per ml in 6 of 90 patients, 6.7% even after 4 doses of vaccine. So the conclusions of this study were the patients do not always receive optimal rabies PEP under real life conditions. So a significant proportion of patients did not develop adequate antibody levels even after 4 doses of vaccine. So this brings us to the importance of lesser dose regimens for a better compliance so that we can prevent complications. So non-compliance to 5 dose, these all are the proven causes of deaths. You can see different case scenarios. The first one being the 58-year female. Here the nature of animal was street dog. It was killed immediately soon. And PEP was given with 3 doses, 037. With Rabipur, and there was no rabies immunoglobulin. You can see the dog bite categories of 3 at the right side of nose, and also shared paresthesias of over face, fever, restlessness, altered sensorium since 1 day. Can you get the CSF findings also? The total cells were 5, monomers were 100, and protein was 126. Sugars were 71, which has corresponding sugar of serum blood sugar was 153. So, and was negative staining. So the diagnosis happened to be which has been considered was rabies encephalitis. So what happened is even there have been confirmatory tests and MRI brain done on this patient, and the treatment regimen they have followed was of modified Milwaukee protocol from day 1. So you can see the MRI findings were consistent. The bilateral brainstem, mild hyperintensities without any restricted diffusion or contrast enhancement on day 2. So outcome was the hospital survival of 16 days, but died after 1 day due to lama. So in these 3 case scenarios of 38 years male and 34 years male, there are many other issues because of let it be because of lamas or because of some financial constraints. The patient had to go lama, and the ultimate result was death of the victims. So the reason of deaths may be due to lack of administration of rabies immunoglobulin or poor compliance to vaccination. So these are the core problems because of death has happened because of rabies. So this is the original article, the compliance to post-exposure prophylaxis among animal bite patients. It's a hospital-based epidemiological study. So this was done in Safdarjung Hospital, New Delhi. Here almost around 360 animal bite patients were taken. So this study was a pre-designed, pre-tested structured questionnaire was administered by the interview technique. So you can see the 6% were delayed and the green was the non-compliant. So around 53%. So around 53% were non-compliant to the full course of ARV. So more than 50% were non-compliant. So this tells us how much important this issue could lead to. So you can see this is from The Ravish Harandale Shankaraya sirs et al. The compliance to anti-rabies vaccination in the post-exposure prophylaxis. This is the brief research article. This study was done at Municipal Corporation Hospitals in Bangalore. Here the sample size was 215 animal bite patients were taken. So one dose of rabies vaccine administered intramuscularly on days 0, 3, 7, 14 and 28 as post-exposure prophylaxis. Also measures the conditions for compliance to complete course. You can see the compliance rate for intramuscular vaccination was 60% at day 28. So on day 0, 100%, because at the time of bite, day 0, everyone will take the vaccine. So coming to the day 3, there was slight decrease to 88%. Day 7, 85, day 14, 70. But on day 28, it was the least compliance of around 60%. So coming for what were the constraints for compliance to complete course of anti-rabies vaccines? There are some reasons which might happen, look silly, but definitely they are impacting the compliance. Like when the timings interface with the school timings around 11%, distance of the hospital, cost incurred, forgotten dates. The main chunk is by the loss of wages. So the main constraint for compliance to complete ARV was loss of wages. It accounted to around 47%. So how exactly the rabies vaccine has evolved? So in 1885, where there was live attenuated vaccine derived from the spinal cord, it was non-standardized diet preparation. I think this was more cumbersome because up to 31 injections of increasing immunogenicity were given, and they have been given around abdomen and all. It was a very cumbersome process. So in 1911, it has come up upgraded to inactivated vaccine, brain up to 10%. It had minimal neural content and it was a liquid preparation. We could bring down the injection from 31 to 14 injections, each 0.5 ml daily. So coming still according to more advances happen in 1976, we have got the cell culture vaccines, which has inactivated vaccine cell culture more than 2.5 IU. Here they have standardized immunogenicity lyophilized. So 5 injections of around 0.5 to 1 ml as per the schedule of 037 1428 have been. So non-compliance led to evolution in treatment regime from 31 dose to 5 dose, and still on we should look further in future how many doses it can come down to. So meeting the unmet medical need, introducing a novel vaccine with simple and shorter regimen. So we have novel 3-dose recombinant rabies G protein vaccine. So it was the first subunit vaccine prepared by virus-like particle platform technology. It was the first vaccine with 3-dose intramuscular regimen. It is given at 0, 3, and 7 days. So it has better compliance due to easy to flow regimen and less visits. So it has good convenience, ready to use, and no reconstitution needed. So we can even prevent contamination. So what is this VLP technology? So virus particle, then this is a VLPs as vaccines. You can see the G protein is difficult to stabilize. So G protein isolation using the VLP technology, purified and stabilized by the Cadila Pharmaceutical Limited. So these virus-like particles are protein complexes which exist as nanoparticles. So these VLPs are similar to native virus particles, but that do not contain the viral genome. So because they do not contain the viral genome, this could be beneficial. They cannot replicate, so but can mimic the viral antigenicity without being pathogenic. So because of this reason, they are capable of inducing a strong humoral and cellular immune response. So this is how these VLPs act as vaccines. So there was a clinical phase 2 study. So in this study design, they have taken around 10 microgram or 50 microgram of into 2-dose regimen and 3-dose regimen. The 2-dose was at 0 and 3, 3 days, and third 3-dose was 0, 3, and 7. You can see each group has around 50 sample size. So 50 people in each group, which have been allocated to 4 groups, you can see. So they have studied the percentage seroprotection which these doses could offer. So you can see in this bar diagram, you can see all the color coded things. So the light blue is of 10 micrograms at 0 and 3 days, and the orange is 10 micrograms at 0, 3, and 7. And the gray one at 50 micrograms at 0 and 3, and yellow 50 micrograms 0, 3, 7. And here the comparator they have taken as Rabipur vaccine 2.5 U per ml. which have been given for 0, 3, 7, 14, and 28 days. So you can see on the x-axis the days post immunization. On the y-axis, you can see the percentage seroprotection each group has been offering. So you see day 14 and day 42 and even day 90 all were offering 100% seroprotection. Whereas coming to day 180, you can see the 10 microgram dose along with, let it be the 2-day or the 3-day regimen, still the percentage of seroprotection has come down to around 90%. So coming to a day 270, whereas the other groups, they have been maintaining 100% seroprotection. Whereas coming for further at day 270, you can see all have the seroprotection has come down to around 80%, but only two groups, that is the orange and the yellow. You can see what is the orange and the yellow. So let it with orange is the 10 microgram dose for the 3-day regimen 037, and also the yellow one, yellow bar gram, which 50 micrograms is 037. So 3-day regimen has been better, has better percentage in seroprotection compared to the 2-day regimen, and also the higher the dose. So the yellow one is at the top, so 50 micrograms. The 3-day regimen offers the highest seroprotection even at day 270. So this is this data we can infer from this study. So the safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as simulated post-exposure immunization. It is a randomized comparator control multicenter phase 3 clinical study. So this has been even published in Human Vaccines and Immunotherapeutic Journal. So coming to the phase 3 study to evaluate the immunogenicity and safety of rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteers. This was a randomized comparative control multicentric study. Here, total subjects were taken of around 800, and they have been randomized in ratio of 2:1. So you can clearly see the TH rabies, so 037 days regimen, around 533 subjects were enrolled, and the reference was taken as Rabipur vaccine, which has been regimen of 037, 14, 28 days regimen. Here, the 267 subjects were enrolled. So what was the results? So you can see the seroprotection, that's efficacy. So the blue one is of TH rabies, and the right, the orange one, maybe the peach one is of the difference. So they have compared seroprotection on day 14 and seroprotection on day 42. So you can see TH rabies has at day 14 offered seroprotection of around 99.24 and reference was 97.72. At day 42, TH rabies offered like 98.69% seroprotection and reference was taken. So the results were consistent across different age groups and genders. So observed differences is 1.52% with the pre-specified margin of around 4%. So in the end, non-inferiority for seroprotection, the primary endpoint day 14 and 42 were met. So test and comparator are identical in seroprotection rate both on days 14 and 42. So this says how much efficient TH rabies vaccine is. So coming to the adverse events, so apart from the seroprotection, even adverse events also would be important. So you can see with TH rabies, the adverse events are very much less. So they were around 9.9% compared with Rabipur, which had 17.2% of adverse events. Here you can see TH rabies has the p-value significant because of almost less than 0.05. Here it was p is equal to 0.0032. So it has very much less adverse events compared to Rabipur. So in particular, coming to the local adverse events as with any injectable, so you can see with TH rabies, localized pain, redness, swelling, all were less compared to the reference Rabipur. So coming to the systemic adverse events, fever, headache, urticaria. Also, these parameters have been compared: fever, ear pain, headache, urticaria, joint pain, and nausea. So here are some parameters because these are very much important in few people. You can see fever was less with TH rabies, headache was less with TH rabies compared to the comparator. And also joint pains and nausea were not, or joint pain and nausea were 0% in TH rabies compared to the reference. So other factors like ear pain, urticaria were little high with TH rabies, but that is not that is very much negligible, like 0.19%. So this influence. So in the end, novel 3-dose has a better safety profile, has significantly less adverse events compared to the reference vaccine. So what was the study conclusion? So novel 3-dose was non-inferior to the reference vaccine Rabipur, less adverse effects compared to the reference vaccine. Novel 3-dose was found to be safe and immunogenic and was comparable to 5 doses of WHO pre-qualified vaccines. So this is very much better molecule because in terms of compliance, in terms of better compliance, in terms of less adverse events, in terms of better safety and tolerability for the patients. So even they have been given few awards: the Pharma Innovation of the Year by the Economic Times and the Golden Globe Tigers Award Malaysia for the Innovative Product of the Year for this TH Rabies brand. Thank you everyone for your patient listening. If there are any queries, I would happy to help you out. Thank you.
Thank you, sir. Thank you very much, Dr. Sir. Dear doctors, dear participants, any doubt you have, you can drop text. You can drop the doubts here. Already we have shared that link, and sir will be answer those questions. If you have any questions,
I think these days there are even few cases like many people have neglected taking vaccine. Let it be a home, let it be home pet, or even if the pet is vaccinated, better to take the prophylactic vaccines to prevent any complication, because if it is delayed, even vaccines cannot help, and there is 100% mortality. So I think even if it's a small scratch or a bite, even if your dog is immunized, even if it's a pet dog, you have to be very careful, not just stray dogs. Even if it's a pet dog, and even if you're traveling in like the forests or different places, remote places, there are high chances of getting scratches because of some unknown animals or insects, or let it be kind of bats. So these things also, the rabid animals, you have to be very cautious. Take for immediate first aid, never neglect, and if necessary, consult your doctor and take advice regarding the immunization, whether to go for active, passive, and how it has to be scheduled.
yes, sir. Yes, sir. Dear doctors, any questions? Please put in the question box marks, and there is a you can ask any question with our doctor, today's speaker, Lokesh sir.
I think slides are very much clear and apt. So
Yes, sir. Yes, sir.
I think main concern would be of if it's a bite, whether to go for what do you say, vaccine or the immunization or the passive immunization. Many would have doubt. I think that depends upon the grade of injury and the wound. Basically, we take the call.
Yes, sir. Yes, sir.
Still, it is very sad to see what do you say, people succumb to rabies, because these we can see in news. I think even the last few months back also, one or two people happen to be diagnosed very late when the patient has the hydrophobia and aerophobia. At that point of time, I mean, still we don't have enough medicines to treat them. So they
Yes, sir.
have been succumbed to death. So prevention is better than cure. So I think everyone need to follow that.
Yes, sir. Yes, sir. So there is one question that patient can take the Travis vaccine the second trimester pregnant. She can take the Travis. Is it safe like that? One doctor is asked the question, sir. Patient second trimester pregnant. She
Okay.
can take the Travis. Is it safe?
So I think in any situation, the simple logic is we have to go with the risk versus benefit. So you see rabies, if the patient contracts, then it's end of life basically, because 100% mortality. So keeping that in mind, risk versus benefit, I think irrespective of that, the patient has to take the vaccine. So for the better life, and I think you can consult with even gynecologist for the future, or obstetrician for future follow up, because you see this is very important. So to my knowledge, I think it's better to take the vaccine. Of course, there might be concern, but it's a live vaccine. They should not take. But risk benefit, I think it's better to take.
Yes, sir. Yes, sir. Dear doctors, any questions? Any other questions?
I think in pregnancy, if you have any other input, any other recommendations, you can put forward from your company side.
Yes, sir. Yes, sir. I think no one is asking questions, sir.
Mhm.
And we can move to closing. Thank you so much, Dr. Lokesh, sir, for the innovative talk. We truly appreciate your efforts, sir. Last but not least, we would like to inform you that Travis has won the 2 prestigious awards in the innovation category, ET India Pharma Award and the Golden Global Tiger Award. Dear doctor, please prescribe my brand Travis. And thank you, Dr. Lokesh, sir, once again for your valuable time spent here. At the same time, the participant doctors also, approximately 150 doctors are participating in this webinar. Thanks a lot for all doctors who are participating in this. Thank you, doctor. Thank you very much.
Yeah. Thank you. Thank you. Good day, everyone. Yeah.
Thanks. Take a support, you can stop the live.